Let's manage endo, the information and tools you'll need to manage the symptoms of endometriosis and pelvic pain. Disclaimer, please note this presentation does not replace treatment provided by medical and allied health professionals. The treatment of endometriosis and pelvic pain responds best to a multidisciplinary care. Please consult your medical professionals before commencing with any of the information provided. Hi guys, my name is Rea. I am a women's and pelvic health osteopath based in Canberra. I work at a beautiful clinic called Fundamental Health. I graduated with my degree in osteopathy from RMIT University, graduating with distinction, and I further completed my Masters of Women's Health Medicine, graduating with excellence. My Instagram handle is osteowithrea, and my direct contact email is osteowithrea@gmail.com. I work with people through menstruation to motherhood to menopause and more. A large focus on my work is with people with pelvic pain. Many of these people have endometriosis, adenomyosis, and other pelvic health conditions, including vulvodynia, painful sex, intercourse, prolapse, and so much more. I found my passion in women's and pelvic health after my own experiences with pelvic pain and subsequent diagnosis of adenomyosis and suspected endometriosis. So this is quite a passionate topic for me. I'm really excited to share my top tips with you, which I hope all of you can implement, and I practically give to every single person I see. So a bit of background info before we get to the goodies. So what's an osteopath? So an osteopath is an allied health professional who takes a whole body and whole person approach to your presentation and your pain. This is commonly referred to as the biopsychosocial approach to care, which we know through evidence is the gold standard of care, and most health professionals start working in this way now. Osteopaths always look at the whole body because the body is so interconnected. There is often more happening than just where the primary pain is. The body is so much more beyond the pelvis, and often there are things going on elsewhere too. Utilising both hands-on management, education, and take-home advice, osteopaths are often at the heart of helping people with pelvic pain. And as you can see off to the side, there's a bit of a diagram explaining what the bio, the social, and the psycho elements are, which inform our pain picture and what's going on in our life in general. So, why does the biopsychosocial approach for endometriosis and pelvic pain matter? Obviously, endometriosis-associated pain has physical, psychological, and social consequences, but appropriate care should also address these in a patient-centered and multidisciplinary way to make sure all of these aspects are being cared for you. And we know chronic pain in general is multidimensional, it's multifaceted, it's a dynamic interaction between all of these paradigms. So we always want to make sure we're looking after you as a whole person. So why does this approach work? We know there's comprehensive research now that shows a long-term, comprehensive, patient-centered, multidisciplinary chronic care model for patients with pelvic pain and endometriosis helps people get increased accurate and timely diagnosis. It reduces the stigma and the burden of pelvic pain. It improves people's overall quality of life. We often see a reduction in things like hospital admission and reliance on pharmacotherapy. We also see overall improved pain management and reduction in comorbid conditions. So it really shows this approach does work, and so many people with endo and pelvic pain get to live their lives in a much happier, healthy way. Why did I tell you all of this? Many people experiencing pelvic pain and diagnosed pelvic health conditions find they are not viewed as a whole person, and the focus goes straight to their physical conditions, and the psychological and social impact just gets left by the wayside. It's not considered, it's not talked about. And as well as focusing on physically just suppressing and minimizing the symptoms without looking at the whole picture of how this condition and pain impacts your life. I tell you this because there are so many incredible allied health professionals and services out there now which work in this multidisciplinary way, which is evidence-based. It works. It's why we're all so passionate about it. And we're trying to help you alongside your core staples of your GP and your specialist. I hope you find your support team wherever you are, be it in person or online, and through using this Manage Endo, because I hope it helps you get to the resources so you can be as self-managed as possible. Now on to the goodies. My first tip, I love giving this to people, is directed breathing. So I want you to lie down in a comfortable position or seated, so you can be seated, resting back. You can use all the pillows, blankets, warmth. You can have your electric blanket on, you can have a heat pack, whatever you need. What I want you to do, I want you to practice this now. I want you to place your hands on your belly. You can place them really broad, or if you're having pain in one spot, you can put it specifically on that spot. I want you to close your eyes and take a nice deep inhale through the nose and sigh out the mouth, going, I want you to get familiar with this. Take 3 breaths, go long in through the nose and sigh out the mouth, going, give me 2 more breaths like that. Now I want you to slowly bring your attention to your hands. Focus on trying to direct your breathing towards your hands. Go nice and slow, just allow your breath to fill towards the area on the inhale. And on the exhale, we just let it go. So we inhale, we focus on softness. On the exhale, we let it go. On the inhale, we just feel our hands rising and we let them fall away. We're not pushing, we're not forcing into our belly. We're just breathing soft in and letting it go on the out. Some people like to think of things that help them. Some people imagine melting butter. Your head feels heavy, shoulders heavy, back, bottom, legs heavy on the bed. Feeling your body melt like butter into toast. Just melting gently and gently, breathing softer and softer. Some people like to imagine waves, not big crashing waves, nice gentle small waves, with the waves rolling into the shore over the sand and slowly retreating away. The waves slowly roll over the sand, gently coming into shore, and they just slowly retreat away. Some people prefer to think of ripples in a pond or a pebble dropping into the ocean, falling deeper and deeper to the depths of the ocean. If you're a visual person, you can pick any visualization that helps you breathe towards those hands and soften and get things moving. Some people like to listen to pretty music or have a guided meditation in the background to help occupy their mind. That's okay too. Often, if you're struggling to breathe down to your belly, you can start with your hands up higher. You can start on your chest, breath in and out, and slowly move your hands down as soon as you feel your hands rise and fall. I recommend to do this for 5 minutes a day. Often it's really nice to do this before bed. Often makes you very sleepy. But if you've had a particularly stressful day, you could do this at work, at your desk. You can do this in your car. You can do this anywhere and everywhere. Give it a go. This is one of my favorites. Top tip number 2, soft belly work. Now, this is going to sound a bit funny, but trust me with this, it works and it feels really good when you get the hang of it. Often with pelvic pain and endo, your poor belly has been tensing and tensing and tensing for dear life trying to support you. Now, if you've had surgeries, there's some scar tissue and potentially some adhesions going on here as well. So gently placing your hands on your stomach, you can start with your breath work first, but you just want to get some movement into your belly. So you're going to start by jiggling it. Now, it's going to sound a bit silly, but all bellies should be soft and jiggly. Doesn't matter if you've got a 6-pack or if you've got a bigger, rounder belly, all bellies should jiggle. So I want you putting your hands on your belly and add a little bit of jiggle into it. Just gently try and jiggle that belly. It should feel soft, it should jiggle. If it feels really hard and really firm, I just want you to jiggle your hand on it. You're really gentle, really soft. You're just trying to get that tissue moving underneath your hands. And as everything starts to jiggle and move evenly, because sometimes one side of your stomach is tighter than the other, you can put some more focus into the area that's tense. As soon as you're feeling like things are moving, you can start doing some knead work. Imagine like a cat making biscuits, that nice gentle movement. We can do that to our belly too, that you're just kneading at your belly, that you're just starting to work through almost those muscle layers. We're not poking, we're not prodding, we're just gently moving our belly. You're so soft to start, and then you can build up based on your tolerance. Some people are too tender, they can't knead, and that's okay. you can just start with the jiggle work. You're just trying to get things moving in a really, really nice way. Now, often you can do this lying. It's usually most comfortable. We're most at rest when we're lying. But again, you could be seated, resting back to do it. You can do it standing as well. And you can apply this work to your glutes, to your thighs. Sometimes even if you've got a bit of a sore shoulder, you can give it a bit of a jiggle, bit of a knead. It all works the same way. Muscles struggle to stay tense and firm when we shake them, when we jiggle them. Confuses our brain. Our brain goes, I guess I must let go. And that's why this is such a successful technique that you can implement anywhere and everywhere. So remember, no belly should be firm. All bellies are supposed to be soft and squishy, and you guessed it, jiggly. My next top tip, we're looking at some scar massage. Now, I've got a reference image here, which is showing it on a longer scar, a cesarean scar, but this applies the same way to laparoscopic scars as well. So all scars should look, feel, and move like regular skin. Most don't, because you were never told or taught to massage your scars. So often laparoscopic scars, they're little, they're tiny, but remember, sometimes if you've got a scar in your belly button, you need to do this to this area too. So with some oil or cream on your hands, I often will use something like a sorbolene cream. You can buy scar-specific creams. Honestly, you don't have to spend much money. I've literally got a $2 tub of sorbolene. Works the same. So you get a little bit on your hand, you rub it across your belly, you make sure it's well lathered, because dry skin on dry skin doesn't feel very nice. So you want to glide really nicely. So what I want you to do, I want you to work through these movements. So you can go up and down, side to side, you can do diagonals, and you can circle in each direction. And you run through this for about 2 minutes. So you go up and down on your scar, side to side, diagonal, circle, circle, repeat. Now, because laparoscopic scars are little, you could do this with 2 fingers, you could do it with 1 finger, you could do it with your whole hand if you want to. Because scars are more than what they appear on the surface. They're little tiny holes on the surface, but we know with laparoscopic surgery, there are deep lines of scar tissue internally. So we start really, really gentle. I always say to people, as gentle as you'd massage a baby's belly to start with, and then you can build up and build up over time. You don't have to be rough on the get-go. And sometimes this work takes time. The older the scar, sometimes it takes a bit longer. Now, we don't do this work while a scar is still healing. We must let a scar be fully healed. It's no longer dressed, it's not scabbing before we do this work. So usually that's after the 6-week mark. Laparoscopic scars, you're sometimes cleared at about 3-4 weeks. And just doing this every day. Some people, if you're eager, you can do this morning and night. A lot of people like doing it when they brush their teeth, or you can do it in the shower. It's a really nice one. You can do it standing, lying, whatever suits you. But this is a really, really nice way of getting your scars moving, and often it can really help your scar pain and your pelvic pain in general. Sometimes even if you don't have any scars, just doing these movements in general to your stomach can feel really relaxing and really nice, and can be nice for people who struggle with constipation and bowel problems as well. Just giving the belly a bit of a massage, because it often helps soften those muscles as well. If you'd like a downloadable PDF of any of these, you can either just screenshot this video, or you can contact me, because I give these as handouts in clinic to people who come see me. So how to reach me? You can contact me on Instagram at osteo.with.rea. My direct email, same thing, osteowithrea@gmail.com. Website, you guessed it, same thing. I'm located at Fundamental Health in Canberra. So we're just in Canberra, south side in the ACT. So always just reach out if you need, because there are plenty of us who are here to help you. But I hope my tips and tricks work for you.